A 45-year-old woman went to see a chiropractor for her back pain. She was recommended to try megavitamin therapy. This is what happened to her kidneys and bones. In 1985, DL, a 45-year-old woman, presented to the Columbia Presbyterian Medical Center with anorexia, an orange hue on her skin, and a broken leg. But she was told to wait as she was given low priority by the hospital staff. However, after some time in the waiting room, she starts to lose consciousness before slipping into a coma. This is when the hospital staff realized that the broken leg was just one of the symptoms of a more serious issue. You see, earlier that year, DL went to see a chiropractor for her back pain, and while back massages and bones cracking didn't really help her, the chiropractor had an idea. DL, you should try a megavitamin therapy, he says. DL never heard about the megavitamin, but since nothing else worked for her back, she decided to give this new therapy a try. It's just vitamins, and vitamins are good for you, she thought. What could possibly go wrong? And at least for a while, the megavitamin therapy worked. She had a huge improvement in the intensity of her back pain. But that wasn't going to last, unfortunately. Just a few weeks after starting the therapy, DL began to lose weight at an alarming rate. Her belly, however, started to look swollen. And then her back pain came back with another symptom. That morning, she woke up too early again because she needed to go to the bathroom for the 5th time after going to bed. But what worried her even more was her skin. It was almost completely orange now. How could I have not noticed this? She thought. This is when she starts to get really upset. And while her husband, woken up by all that commotion, tries to calm her, DL trips and falls, breaking her leg. Gathering here, what I have for you today is a cautionary tale. This story is based on events that actually happened and that were documented on medical journals. And it's all about the single most dangerous vitamin you should never supplement. Seriously, don't supplement anything without talking to your doctor. So the question is, do you know which vitamin is the most dangerous to supplement? Now, the assumption here is that you should never supplement any vitamin without a specific need, especially if you have kidney disease, diabetes, or another diagnosed condition, especially not in high doses. Because while vitamins may be extremely helpful if supplemented correctly, all supplements have some inherent danger. And there are some vitamins that are more dangerous than others. You see, there are two kinds of vitamins. Those that are soluble in water include vitamins of the B group and vitamin C, and those that are soluble in fat, including vitamin A, D, E, and K. While water-soluble vitamins are immediately excreted by the kidneys, when taken in too high doses, fat-soluble vitamins can accumulate in your body's tissues. This makes them dangerous when taken for too long periods of time or in too high doses. And one of these vitamins was taken by DL in very high doses as recommended by a very incompetent practitioner. In just few weeks, it caused her to start urinating uncontrollably, dozens of times a day. It also caused her to develop anorexia. It caused her belly to become swollen, her skin to become orange, and her bones to break. What happened to DL kidneys and bones when she started a megavitamin therapy? At physical examination, the medical staff at the Columbia Presbyterian Medical Center found out that DL's skin was not just orange but also very dry. Her nails were fractured and a fluid buildup in her abdomen was also found, which was causing her stomach to be swollen. This could mean that DL liver was damaged, but blood tests indicated that liver function was instead normal. DL creatinine was, on the other hand, too high at 4.1 mg per DL, indicating that her kidneys were taking damage. But this creatinine level didn't explain her symptoms. After further examinations, the doctors were finally able to find a clue. DL was suffering from hypercalcemia, or very high levels of calcium in blood. They didn't find, however, any vitamin level to be too high. Instead, it was revealed that DL was dehydrated, which is consistent with her profuse urination before falling into coma. There are now a few clues for what is causing DL to go into coma. anorexia. Fluid in her abdomen, brittlness of her bones and nails, skin that became orange, very high calcium level in her blood. The doctors also knew from DL husband that she was undergoing a megavitamin therapy. He didn't know, unfortunately, which or how many vitamins she was taking. Which vitamin sent DL to the emergency room? Now guys, if you can tell which vitamin is causing all of DL symptoms before our doctors came up with a diagnosis, write the answer down in comment section. The vitamin DL was taking is the most dangerous vitamin there is, especially for someone with kidney problems. We will follow her medical team as they try and diagnose what is causing all of her problems, but if you can guess at any time which vitamin is the culprit, write it down. It's clear that DL is suffering from hypervitaminosis, and that's responsible for her liver and kidney damage, her hypercalcemia, and her broken bone. The doctors knew that no water-soluble vitamin could have caused all of her troubles, mainly because water-soluble vitamin cannot stay in the body for too long since they get excreted in the urines, and all the vitamin levels in DL blood were regular. This leaves us with 4 vitamins: vitamin A, vitamin D, E, and K. Vitamin E toxicity hypothesis was also discarded because vitamin E has a strong blood thinning effect, and DL wasn't suffering from any bleeding. Vitamin K was also discarded because vitamin K is used by the body to bind calcium. DL calcium levels would have been too low, not too high. Now, both vitamin A and D are linked to calcium metabolism. Both vitamin A and vitamin D can cause calcium levels in blood to be too high. But only one of these vitamins will cause the skin to turn orange and liver and kidney toxicity. Have you guessed which one? Now guys, we will see if DL was eventually able to make it in a moment. As I was saying, this video is a cautionary tale. It's not uncommon to read in medical literature about people erroneously recommended to do therapies that cause more harm than good. And in many cases, medical practitioners that are not supposed to prescribe any drug at all, such as a chiropractor, are the cause. We have also seen that happening in my video about aristolactic acid. That was a very unusual case study. A woman progressed from normal renal function to advanced renal failure and end-stage renal disease in just 8 months. She needed a transplant after that. Her kidneys never recovered. According to the documentation, 5 months before the start of the symptoms, the woman took herbal medicine for pain relief, and that herbal medicine was prescribed to her by her acupuncturist. This video is up here if you miss it. And while vitamins are usually safer than herbal remedies, many people take them in doses that are way above the recommended daily allowance. This is what megavitamin therapy is all about. Megavitamin therapy is the use of large doses of vitamins, often many times greater than the recommended dietary allowance, in the attempt to prevent or treat diseases. And it was eventually found out that what caused all of the DL problem was exactly that. It was eventually performed a transjugular liver biopsy on DL. In this procedure, a catheter is placed through the jugular vein in the neck, guided through the heart and down into the liver, where a sample is collected. What was found confirmed the doctor's hypothesis. DL had an increased number of fat-laden stellate cells, meaning that vitamin A had been accumulating for some time in her liver, engorging the cells, causing them to die and form scar tissue inside the liver. This means that DL was experiencing vitamin A-induced hepatotoxicity, and that the megavitamin therapy was slowly destroying her liver and kidneys. And as I was saying, vitamin A is extremely dangerous for someone with kidney disease. It is crucial for someone with CKD to never supplement vitamin A. As I was saying, if the kidneys cannot remove this vitamin properly, toxicity and damage to organs are even more likely. And even if DL didn't have kidney problems before her megavitamin therapy, she took enough vitamin A to damage her kidneys too. But the doctors were more worried about her hypercalcemia. It required therapy with mithramycin. This is an antibiotic that also used to treat cancer and to bind to excess calcium in blood. Okay, do you want to know how it ends? Did she make it? Let's see. A After the second treatment with mithramycin, her calcium levels stabilized in the normal range and DL was eventually able to exit the coma. The problem with vitamin A is that there is no way to remove it from the liver, however. Doctors were able to treat her fractured bone. They were also able to drain the fluid in her abdomen. But there is nothing to do about excess vitamin A. This is why her calcium levels kept rising during the next months. She was eventually discharged and recommended to immediately stop the megavitamin therapy, which she did. She was also being monitored as an outpatient for her liver and kidney function. At discharge, nail and skin problems were beginning to resolve and the swelling in her abdomen was diminished, indicating some recovery of liver damage. But her calcium levels kept being too high for several months. Her liver disease progressed with the development of further swelling in her abdomen. But clinical evidence for improvement in other areas was appreciated by a gradual return of muscle strength and improved mental status. She was able to gain some of her weight back and eventually she made a recovery. A 33-year-old mom decided to drink just one more cup of coffee to keep up with her busy schedule. This is how her kidneys were shredded to pieces. Ovi is a 33-year-old mother of 3. She always considered having 3 kids a full-time job. And especially since her newborn arrived, that also proved to be a nighttime job. Only problem? Ovi also had a full-time job. And with her 1-year-old keeping her awake at night, being present at work during the day became very hard for her. This is why she has gotten into the habit of seeking for help in liquid form. And everything was fine until it wasn't. That fateful Monday morning on her way to work, Ovi decided to pick up just one more pumpkin spice latte to help her with the morning tasks. But she already had her morning coffee. Well, 2 cups actually. And a couple of Red Bulls on top of that because, well, she didn't really sleep that night. But there was no time to think about how much caffeine she was getting. She was late to work again, and she knew how furious her boss was gonna be. In the morning traffic now, Ovi is worried she will not make it in time. But wait, why is my heart pounding so fast? She thought. Something is not right, she thought. She was very nauseating now, and she was feeling a pain in her chest. Luckily, she is able to stop the car before anything worse happens. She throws up. Out of the car now, Ovi lies on the floor. She starts to shake uncontrollably. Ovi is now having her first seizure. A passerby sees her and calls for an ambulance. Less than half an hour later, she is in the emergency department of the nearest hospital. Her conditions are serious. Gathering here, welcome today to a new mystery from the emergency room. Today we talk about coffee. Recent report states that every time we put some in our bodies, our kidneys may get damaged. This is true at least for half the world's population. Here's why. Medical news today titled "Drinking 3 or more cups of coffee daily may increase your risk for CRF." So what's new about that? While some studies listed coffee as a danger, previous consensus in the medical world was that drinking up to 400 milligrams of caffeine per day, which translates into 4 cups of brewed coffee, is perfectly acceptable. Not just that, studies state that there are metabolic benefits from drinking coffee. In particular, a recent review of 34 studies on people with hypertension, heart problems, and diabetes found out that drinking coffee in moderation is not just safe for people with metabolic problems, it is even beneficial. This is also due to the fact that coffee shows more antioxidant activity than green tea and cocoa, for example, two antioxidant superstars. And this really matters. However, a new study seems to put everything in discussion again by proving that half the population may be damaging their kidneys just by drinking coffee every day. Is this what happened to our protagonist, Ovi? Let's find out. In the emergency room now. At examination, the staff had no idea about what happened to Ovi. Her husband is immediately contacted and he is given bad news. His wife, perfectly healthy until that day, is now risking her life. No, it wasn't a car accident. Even worse, the staff has no idea about what's going on. She had another seizure during the trip in the ambulance. Ovi is sweaty. She is agitated and confused. She's shaking and hyperventilating, and she can't really tell what's happening either. She was going on with her busy morning when she had a seizure. But why? Exams are ordered and Ovi is also found out to have hyperthermia or too high body temperature. This is a very bad sign after a seizure. It means something dangerous is still going on. When Ovi is asked what's happened to her, all she can say is, too much coffee. More tests are ordered and the staff finally had a clue about what's going on. So question, what caused Ovi to have a seizure? What the hospital staff reads on her test was unusual. Firstly, they find that she has hypokalemia. This means that her potassium level was too low, low enough to cause her heart to beat erratically. You see, potassium is used by the body as a signaling molecule. It tells the muscles to contract or to stop contracting. And this is also true for the cardiac muscle. And that could explain the seizures. But during the test, the hospital staff also found another very worrying problem. Her creatinine is now 8.4 milligrams per dl. She was in dire need of emergency RRT now. But as the staff reads the results, Ovi suddenly falls unconscious. Again, her heart isn't beating anymore. Something inside her body is making all the signals from her brain malfunction. Her heart is now just shaking in place instead of beating, and blood can get to her brain. Doctors immediately rush in to do CPR. She is eventually resuscitated. But over the next few hours, these cardiac arrests happened 3 more times. Beta blockers to stabilize her were given, but to no avail. You see, beta blockers are used as the first line against caffeine toxicity in clinical setting. Why aren't they working on Ovi? Will the hospital staff be able to understand what's going on before it's too late? Okay guys, today's medical mystery is a very unique story. Caffeine toxicity is not something we see very often in clinical practice, especially not from beverages alone. When asked what happened, the only thing Ovi was able to say before becoming unconscious again was, too much coffee. She knew that she was getting into the habit of drinking too much coffee every day. But how can that cause a seizure? Well, coffee is a stimulant. In moderate amounts, like 1 cup of coffee, it can help you stay awake. It helps completing more tasks during the day. The thing with coffee is, your body adapts to it. After a while of drinking coffee regularly, you might find you've developed a tolerance. This is very common and it doesn't usually mean there is a problem. By the way, you can tell if you are developing a tolerance to coffee because you will get a headache when you don't consume it during the day. That means you're experiencing withdrawal. Caffeine appears to constrict the blood vessels in the brain, so when you don't have it, the blood vessels are dilated and that can cause the headache. Now, like many substances that have an effect on the brain, caffeine effects largely depend on the amount you have in your body. We know that taking less than 300 milligrams of caffeine per day is considered safe. But how much caffeine did Ovi take that day? She had 2 large cups of coffee, 300 milligrams of caffeine, then 2 Red Bulls, another 250 milligrams. Then 1 large pumpkin spice latte, another 200 milligrams caffeine. That's around 750 milligrams, more than twice the limit. But she didn't consume that caffeine in a day. Ovi consumed all that caffeine in less than 2 hours. Into big amounts, like what Ovi ingested, caffeine won't just keep you awake. It will do many other things. It may block the brain from sending the right signals to the heart. The brain uses electricity to send signals. It also uses chemicals to modulate these signals. What caffeine does in the brain is blocking these modulators. It causes the brain to get excited. That's why it makes you feel awake. But if 750 milligrams or more caffeine are present in the body, most of the signals are unmodulated. The brain doesn't stop getting excited. Everything discharges at once, which is bad. In scientific terms, this is a seizure. In the case of Ovi, it was a tonic-clonic seizure, which also caused cardiac arrest. This is a type of seizure that involves a loss of consciousness and intense muscle contractions. Now, in some cases, when these contractions are so strong and they last for too long, they may literally destroy a large amount of muscle tissue in the body. This is a serious condition called rhabdomyolysis. Rhabd occurs when damaged muscle tissue releases its proteins and electrolytes into the circulation. This huge amount of protein punches through the nephrons like they're made of butter. And this also explains why Ovi creatinine was so high. She was suffering from AKI, caused by rhabdomyolysis. We will see if the hospital staff will find the right way to control this serious condition in a moment. Before that, what many people may be asking now is, what if you only consume a moderate amount of coffee every day? Can it still be bad for you? There has been a long-standing controversy regarding coffee safety on hypertension, heart health, and consequently on kidney health. Coffee is one of the most widely consumed beverages in the world, so today's scientists have tons of data on it. Thing is, data about coffee is not uniform. Certain studies say coffee is good for you. Other studies say it can, on the other hand, damage the precious filters of the body. In other words, some people seem to get benefits from caffeine. Others seem to damage their organs even when drinking less than 4 cups of coffee per day. As we have seen in the beginning of the video, a new study seems to have found a reason why this discrepancy happens, which is a variation on a gene called CYP1A2. According to this study that aims to reconcile the previous data, half the population, those with this variation, will increase their risk of developing kidney dysfunction even by drinking less than the maximum tolerable amount of coffee. This means that for 1 out of 2 people, drinking coffee means causing actual damage. What the author of this study recommended is a re-examination of the current guidelines, approving up to 300 milligrams or 3 to 4 cups of brewed coffee per day. So the less caffeine you drink, the better, according to this study. Now guys, if you ask my opinion about coffee, I'd say not to worry. There is one more new study about coffee every day. I'm not kidding. While I was writing the script for this video, some news popped up on my feed. Researchers published a study on the BMJ, literally the 15th of March. which is today for me and 2 days ago for you if you're watching this video on publishing date. What they found out is that caffeine is really good for you. It may reduce the risk for obesity and T2D and prevent metabolic diseases. Probably tomorrow they will say it is bad again. However, but the general consensus is still that coffee is not harmful if you drink it in moderation, and most importantly, if you don't take it with sugar, creamers, and other junk foods. And I also want to add one thing. In my experience, the sooner in the day you stop drinking coffee, the better. Caffeine is also known to decrease sleep quality, which in turn may affect kidney health negatively. According to the FDA, the half-life of caffeine is between 4 and 6 hours. This means that up to 6 hours after drinking a caffeinated beverage, half of the caffeine you consume is still present in your body. And you really want all that caffeine to be out of your body already when you go to bed. In short, you want to only consume coffee in moderation and only early in the morning. But what would happen if you disregarded all this advice and took a huge amount of caffeine in a very short amount of time? How bad will it be? Let's find out. Well, ODing on coffee is rare. You see, people usually understand pretty quickly what their threshold for coffee is, but that doesn't mean it cannot happen. In 2017, a South Carolina student tragically passed away after drinking too many caffeinated beverages in a short amount of time. The coroner declared that he drank a latte from McDonald's, a large Mountain Dew soda, and a highly caffeinated energy drink in just under 2 hours. And while this is an uncommon tragedy, there have been more hospitalizations reportedly caused by caffeine supplements. Caffeine supplements are dangerous because you can get the same caffeine from the tip of a teaspoon of powder as from a large cup of coffee. Earlier this year, a 29-year-old personal trainer from Wales passed away after a measuring mistake with a caffeine supplement. The father of two miscalculated the amount of powder he was meant to use for his workout. Paramedics tried to resuscitate him for 45 minutes, but he was later pronounced dead. So, is our protagonist going to suffer the same fate, or will the hospital staff be able to save her? In clinical setting, caffeine poisoning is rare, but it's not unheard of. There are procedures and guidelines to treat it. When there is cardiac arrest, like in Ovi's case, chest compression and defibrillation are used. There are also medicines that can be given to stop the toxicity of caffeine. But in some cases, it's not enough. After prolonged and apparently useless defibrillation attempts, the doctors finally decide to try an innovative procedure. You know, there are ways documented in literature to successfully treat caffeine poisoning. A recent study reported that a really high dose of insulin that could only be done in a controlled setting inside a hospital could work. It was Ovi's last chance. And it worked. Her parameters stabilized very quickly and she stopped having heart attacks. As soon as Ovi was stable, she was given fluids and was started on RRT to protect her kidneys. She was then given insulin for 72 hours. After a few days, Ovi was eventually able to go home safe to her husband and kids and to recover at least part of her renal function. Luckily for her, there was no lasting brain damage either. A man only drank this fruit juice for a week. This is what happened to his kidneys. The protagonist of this story is a 65-year-old, a father of two, and a diabetes patient. I will call him UL from now on. UL never had any issues with his kidneys before, but today he was being hospitalized because he could barely make any urine at all anymore. UL is accompanied by his son, and now they're waiting for a doctor to see him. "Why are you wearing those sweatpants, Dad?" asked his son. "Because my regular trousers wouldn't fit anymore," tried to answer UL. But they were cold in, so he wasn't able to complete the sentence. The doctor finally came. UL was immediately asked if he drank alcohol or if he was taking any pain medication. UL said that the only medications he was taking were those for his diabetes and his ulcer. But the doctor knew that something was very wrong with UL kidneys. He knew this as soon as he entered the room. UL's breath was smelling very bad, like ammonia. The swollen legs and the fact that he complained about not making urine were enough for the doctor to order immediate blood analysis and to start UL on dialysis. After a few hours, UL creatinine levels confirmed what the ER doctor already knew. UL kidneys were not working anymore. But how is it possible that the man with no previous kidney issues ended up on dialysis after drinking a normal fruit juice for just a week? Welcome today to a new story from the emergency room. This is the story of a man that lost his kidney function completely and in just a week. The reason? Fruit juice. Now, this is no work of fiction. Everything we will see today is based on a case report published the 28th of December 2023 in a peer-reviewed medical journal. This all happened in a very similar way to what I will show you. If you are suffering from kidney problems or diabetes, the food you eat can be the most powerful medicine and your best ally in fighting the disease. But in some cases, what you eat can also worsen or even cause diseases. Just usually not in 7 days. It's common to hear about people that ruin their health by eating too much junk food and too little fruit and veggies, but the damage usually happens over a lifetime, not in a week. And this is what makes today's report so incredible. Today we will find out exactly how drinking regular fruit juice can be one of the fastest ways possible to destroy the kidneys. But this is not the only reason why this story is going to be interesting. You see, what today's case report will show you is that certain fat diets are better left to internet influencers. Let's see more about UL case now. After being started on dialysis, UL was finally stabilized. The doctors were now able to take a proper medical history from him, so they started asking him questions. "UL, is there anything I should know?" asked the doctor. "Your kidneys are not well. Are you taking medications? Do you drink?" "No, I am a man of routine," answered UL. "I take my metformin and glipizide rigorously, and I always keep my sugar levels in check." It was true. He was neither an alcoholic nor a smoker and had no family history of kidney disease. He had never had any issues with his kidneys before. However, he was also suffering from a stomach ulcer, and that was a pretty serious issue. Just 2 days prior, UL had left another hospital where he had been treated for this stomach ulcer. The issue was so serious that it had caused him to vomit blood. He had been stable when he left, but the ordeal had left him weak. This is when the results of UL blood analysis came back. The ER doctor at this point was starting to be very confused. According to UL tests, his creatinine levels were very high, 5.43 milligrams per dl, but that was expected since the patient was now on dialysis. Proteinuria was also present, and that is an indication that there was something damaging the kidneys. Maybe it's oxalate formations, thought the doctor. But no, because UL oxalate levels were in the normal range. How could a man lose all of his kidney function in just 7 days with no signs of toxicity or stone formations in the kidneys? This case is becoming interesting, thought the ER doctor. Okay guys, looks like we are facing a true medical mystery today. So this patient was firstly hospitalized a week ago for a problem that has nothing to do with the kidneys. His kidneys were actually perfectly fine back then, which is almost unusual for someone his age and suffering from diabetes. Now the patient is being treated for an ulcer. But while this treatment goes well, just 1 week after this first hospitalization, his kidneys fail completely. How is this even possible? Well, let's find out. I bet the ER doctor will want to talk to the patient now. UL, he asked, is there anything out of the ordinary they gave you at the other hospital? Well, there is the diet I'm following, answered UL. Now, as it turned out, when UL was admitted to the first hospital 1 week ago, the doctors kept him nil per os for 1 day. Just one, because they needed to perform an endoscopy. Nil per os is a medical term that means nothing by mouth. It's often used in situations where a patient is about to undergo a procedure that requires an empty stomach, such as endoscopy. The endoscopy revealed a gastric ulcer that was treated with proton pump inhibitors. However, after the endoscopy, the doctors recommended UL to follow a semi-solid diet for 48 hours. Make sure you are eating very light, they told him. But UL wasn't sure that the very light diet was enough for his situation. So he decided to dig deeper, and he found out about an influencer recommending people with gastric ulcer to follow a very strange diet. After being questioned for a while, UL finally revealed his secret. For the last week, starting just after the endoscopy, he decided to follow a juice-only diet. You see, UL was somehow convinced that drinking only pomegranate juice without added sugar, obviously, was the cure for his ulcer. No food whatsoever, just the juice. However, as soon as he started this diet, his kidney function started to deteriorate. In just a few days, he went from healthy kidneys to dialysis. But how is this even possible? There must have been a medical explanation for what was happening. People just don't go from healthy kidneys to dialysis in 1 week. Is the pomegranate juice the cause of his huge amount of kidney damage? Well, there is only one way to find out, said the ER doctor. A renal biopsy will tell us. So, what we are seeing here is exactly what destroyed UL kidneys. In a renal biopsy, a small piece of kidney is removed and examined under a microscope. And what the doctors found in UL kidneys was so remarkable they actually wrote and published an article about it. So, what are we looking at? Now, the structure we see here is a tubule, alright? This is very small. It is part of the nephron, the filtering unit of the kidneys. If too many of these tubules stop working because they are damaged, the kidney will stop working also. And this is exactly how a damaged tubule would look like. If we zoom in, we can see that there is a structure inside the tubule which looks like a diamond or a crystal. A calcium oxalate crystal, to be exact. There are two of them in this picture, where the arrows are pointing at. Now, around the crystals, we can also see that the kidney cells are being destroyed. Wait, now you may ask, but you said that UL didn't have oxalate in his urine. How is this possible? How is it possible that a man with no history of kidney stones and no oxalate in his urine completely lost his kidney function due to calcium oxalate crystals? Well, to answer this question, the doctors decided to take a look at what UL was eating. And he wasn't eating anything at all containing oxalate. Actually, some sources support the theory that drinking pomegranate juice may even help with kidney stones. You see, kidney stones are formed when there is too much oxalate being filtered through the kidneys. The kidneys need to bind this oxalate to calcium, and this process may form kidney stones or, like in UL case, tiny crystals. But where is this oxalate coming from then? In your diet, foods such as vegetables, nuts, and grains are probably the biggest source of oxalates. But UL wasn't eating any fruit or nuts. He wasn't actually eating anything at all. He was just drinking pomegranate juice, and that juice doesn't contain oxalate. So what's happening? Well, there is actually something inside this pomegranate juice that could have damaged his kidneys. Something that is not oxalate but that actually turns into oxalate inside the body. Here's what the published case report says about this. Many reports describe oxalate nephropathy after the administration of vitamin supplements or citrus juice. The source of vitamin C in our patient was pomegranate juice. Oh, it looks like the very unusual diet UL was following is the cause of his kidney damage. In fact, as this paper points out, excess vitamin C inside the body is partly converted into oxalate, and this was the cause of the serious kidney damage UL experienced. Now, a very important question. Are vitamin C rich foods dangerous for people with kidney issues? We know today that people suffering from chronic kidney disease and those at risk for kidney stones should be careful with vitamin C supplements, alright? Vitamin C supplements are a known cause of kidney stones, but UL wasn't taking any supplements. Is the vitamin C from foods dangerous too? Well, you see, it's not the food itself the problem. It's following dangerous fad diets, just a juice-only diet. You see, while drinking just a bit of pomegranate juice may actually help people suffering from kidney stones, drinking too much of it or just it may be very dangerous. First of all, because of all the vitamin C this juice contains. You see, it is usually recommended to avoid taking more than 100 milligrams a day of vitamin C. This is especially important for kidney disease or diabetes patients. Okay guys, it's almost time to see if UL was eventually able to save his kidneys. Before that, there is a very important lesson to learn from his serious mistake. The lesson here is that following crazy fad diets always comes with risks. And this juice-only diet is not the only diet that presents a hidden danger, especially if you are suffering from conditions such as diabetes or kidney disease. Following the wrong diet can be very harmful. This is why I always discourage people from following potentially harmful diets such as keto diets or paleo diets or carnivore diets. We have seen in the past how kidney disease sufferers tragically lost their lives just because they were following a keto diet. The 27-year-old Indian actress passed away in 2020 just because she decided to treat her kidney disease with a keto diet. And she is the most famous case, but she is not the only one, unfortunately. Completely removing essential parts from your diet always comes with hidden dangers. Don't take this risk. Now guys, the diet UL was following was just as crazy as the keto diet because you see, it's not the amount of vitamin C in the fruit juice that destroyed his kidneys. It's the lack of any other food in his diet. And as we can see here, UL was drinking almost 1 liter or 34 ounces of juice per day, which is about 450 milligrams of vitamin C per day. Now guys, this is not a very high amount of vitamin C. Many people take even 4 times that vitamin C per day without problems and for way longer than a week. The researchers that published the case report believe that the reason why UL had this problem were his age and his diabetes status. Both these conditions are risk factors for calcium oxalate crystal formation. And they also point out that as his kidney function decreased, the amount of oxalate produced increased, which is something kidney disease patients must keep in mind. I also want to add that a diet that doesn't contain any calcium in it, like the diet UL was following, is also going to increase the risk for calcium oxalate formation. This is why I always recommend to consult a doctor and a dietitian before making any significant changes to your diet. Okay guys, do you want to see how it ends? Let's see if UL was eventually able to make it home safe. After his hospitalization, UL was started on dialysis. You see, UL never had chronic kidney disease, and by completely stopping what was causing damage to his kidneys, there is hope for him to get enough kidney function back. UL was also instructed about his condition and started an Oxalobacter formigenes capsules twice daily. Now, this is very interesting for people suffering from kidney stones. Oxalobacter formigenes is a relatively new treatment for kidney stones that's very promising. This is actually a bacterium, alright? It's a bit like a probiotic. When this bacterium colonizes the gastrointestinal tract, it can actually degrade oxalate even before it reaches the kidneys. This would in turn reduce the risk for kidney stones in the future. Yes, an incredibly advanced treatment, and a study suggests that this treatment may reduce the risk for kidney stones by a whopping 70%. So I bet that this will help you all in the future. Remember that this case report is from just 1 year ago. But was you all able to gain back enough kidney function to avoid dialysis then? After 2 weeks on dialysis in the hospital, UL gained back a little bit of kidney function. But when he left the hospital, his kidney function was still too low for him to be dialysis free. But he was recovering. And I want to believe that eventually his kidneys recovered at the point that he is now able to control his CKD with a renal diet. Who knows, maybe he is watching me right now. Now guys, I'm glad I talked about oxalate and the risk connected with, because as we have seen, some kidney patients should actually limit their intake of this substance. And this is all for today. Thank you for watching. God bless you all. Bye.